Hey guys, it's Dr. Justin Southall with Eastern Shore Chiropractic and Sports Clinic in Fairhope, Alabama. We've got Chase Moy with us, our active release technique specialist. Today we're going to follow up and continue on with what we've been working on, the low back series. And today we're going to work on hip and low back mobility. We're going to do just a few simple exercises and mobility drills that you can do at home, at the hotel room, at basically any place that you can find a place to lay down. So we're going to start out with foam rolling. Everyone asks about foam rolling. Yeah, this one looks like a torture device, but actually it's pretty awesome. I'm going to have Chase, he's going to get down, we're going to work on glute mobility of the hips. And so what he is going to do is going to place the foam roller down on the ground, and he's going to target his glute piriformis area with the side of the roller. You can do the soft side or you can do the rib side. So go ahead and get onto that. He's going to position himself where it's comfortable, and you're going to work back and forth for a period of anywhere from 15 seconds up to a minute, trying to get the tight spots released. And from there, after he progresses, he can work down into the side of the leg, into the quads, or even into the hamstrings to release this. If you don't have a foam roller, which some people don't, most people either have a tennis ball, a softball, or the best tool that you can buy is called the Supernova, and you can get it from Rogue Fitness. He's going to take the ball, the Supernova, and he's going to apply it right to the glute as he's searching through there trying to find that tight spot. Once he finds it, he's going to sit on it for anywhere from 15 seconds up to a minute. You don't want to stay on it for long periods of time, because that long period of time will end up causing you to be bruised or sore. So the shorter amount of time you can get that change that we're looking for, that release, is going to make the most difference. He can also progress down into the hamstring and the legs with it as well. So from there, we've just released the glutes, piriformis, all your hip rotators. We're going to work to the low back muscles. Everyone said, what can I do for my low back? Well, he's going to lay on his side. Start out with a tennis ball. If you're really, really tender or sore, you want something a little bit more gentle. Eventually we'll progress to a lacrosse ball. But we'll start out with the tennis ball. This is just a trigger point ball. And what we're going to do is we're going to target the erector muscles here. Don't place the ball on the spine or the bone, just muscle. They're going to go just right here. So he's actually going to take these and he's going to lay on his back and he's going to target them right on those muscles that I just showed you. Keeping the feet on the floor initially, he's going to work it back and forth to get that change, that release, and that muscle that we're looking for. As he progresses through there, we're going to get a little bit of soreness. It's going to be a hurt so good, but it should not be painful. And we're looking for just that release. As you progress, the legs can come up. Don't do this at first. You're looking at a month to up to 2 or 3 months of doing this before you can get the muscles relaxed enough to do it. So he's going to come off of that. Again, 15 seconds up to a minute, that's all you need. And finally, one of the most effective things to do for everyone that has low back pain, that sits all day, is releasing your hip flexor, the psoas, which we talked about stretching, how to strengthen all that last week. We're going to take this. This is just a simple soft med ball. You can use a ball from Dollar General, Walmart, wherever. But he's going to take it, place it on the floor, and he's going to target right to the hip flexor. He's going to lay on it right here. Basically, it's like a gut smash or a psoas smash. The Supernova works great, but you don't want to start out with this. It's too hard, too dense. 15 seconds up to a minute, trying to get that to release. As he progresses, we've all talked about the resistance band. We can take the resistance band to help him and pull that through, and that's going to help to lengthen that as well. He could also use the other leg as well, and it'll give a nice direct stretch to the psoas. So those are 4 simple things we can do to release the muscles, get your mobility increased, but right afterwards you need to do the stretch routine that we showed you 2 weeks ago. And we're going to add in a couch stretch, which it's called a couch stretch because you're going to use a couch or a chair. You're going to make sure you have a pillow or a cushion right underneath. He's going to come straight down. If you have any knee pain, knee surgery, anything, don't do this. You're going to get this good stretch. He's going to take his arm all the way up. It's going to lengthen the psoas, your hip flexor, and get that good pull right after we just released it, which is going to allow it to release. And finally, how do we stretch that glute? The lower back, when I've been sitting in a chair all day long or driving in a car, he's going to cross his leg over. He's going to push this down. The back's going to stay straight. He's going to lean forward, and then he's going to rotate, and then rotate the other direction. Very good. Great job. So that's very easy ways to increase your mobility in your hips and your low back. This is Eastern Shore Chiropractic, Dr. Justin Southall and Chase Moy. We are your favorite chiropractor. Stay tuned next week. We're going to talk about plantar fasciitis and 4 easy steps to release that pain. It's your life living in health.